Tune in to Home Sweet Tokyo Season 4 for some wholehearted family fun on NHK World Japan.
Watch NHK World Japan now over the air and on Comcast and Verizon.
State Circle is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you.
Connecting Marylanders to their government. This is State Circle.
Good evening. Welcome to State Circle. Coming up tonight, sharp cuts are planned for the Washington Metro system, and dads making desks for kids in need. But first tonight, the surge in COVID cases continues. Maryland hospitals are about 90% full with over 1,700 coronavirus patients. That is up from about 1,600 last week and about 500 just 6 weeks ago. Several local jurisdictions are adding new restrictions to try to slow the spread of the virus. New Baltimore Mayor Brandon Scott was sworn in this week and immediately increased restrictions, including limits on restaurants. They can offer carry-out only. Anne Arundel County Executive Stuart Pittman announced a similar move lasting 4 weeks and taking effect on Wednesday.
The actions that we're announcing today are for 4 weeks. If at the end of 4 weeks, it turns out that our hospitals, and these are the metrics that I'm looking at the most closely, is hospital capacity. If our hospitals are doing fine and the hospitalization increases did not happen as projected, that will tell us something, and it's likely that we will then be back on the track to reopening.
Governor Hogan later said that counties can impose their own restrictions, but in his view, the harm to small businesses currently outweighs what he says is a relatively small source of virus transmission.
And we just invested $50 million that we gave to the counties to help keep restaurants afloat and keep restaurant employees working by providing for money for heaters and tents and filtration systems and things to keep people safe dining outdoors. But it's not something that I think I would have done.
Our newsmaker this week is Leslie Simmons, Chief Operating Officer of LifeBridge Health. Thank you very much for joining us.
It's my pleasure. Thank you for having us.
You operate 3 acute care hospitals, one in Baltimore County, one in Carroll County. As we've seen this second surge statewide, what are you seeing at your institutions?
Well, I'll tell you, Jeff, it's quite different than the beginning of the surge, than the beginning in the springtime. This time, it's a bigger challenge. The patients are coming fast and furious. We do know more now than we did in the springtime, but this time the staff is affected. So the staff is affected with some community acquired COVID themselves. So our resources are a little bit actually more limited than the springtime. So it has been quite a challenge, and it's ramped up very rapidly, I think is the other challenge.
What about the balance between acute care beds and intensive care? When I look at the chart that the state has, we're at the high water mark from the spring, a little bit above it in terms of the total number of people in the hospital. In terms of intensive care, it peaked in May around 600 intensive care beds, which I think is about half of the state capacity. But now it's up around 400. Do you see that at your institutions, maybe a little bit less intensive care use as a percentage compared to the first time?
Exactly. We are pretty consistent with the state in that regard. That mix is just about right. A little bit less critical care bed utilization, more general medical surgical utilization.
Your background was in nursing, I understand, before you got into management. So I'm sure you still look at it from the patient care perspective and the perspective of your colleagues who are on the front lines. You mentioned they've been affected by community spread. How's everybody doing?
Well, I'm proud to say I still maintain my nursing license, and I bring that to my work each and every day. And you know what? There is a sense of fatigue, Jeff. I think it is Oh, here we go again. On one hand, there is optimism because, frankly, we know a lot more about how to care for this virus than we did in the springtime. So there's some reassurance in that. But it's that gearing up for, another spike, another period of intensity. And that is where it's just kind of wearing on people. I will say we're kind of excited that the vaccine is upon us, and that's our light at the end of the tunnel. So right now we're just working to support the staff for, come on, let's push hard, one more rally, and then we'll make it over. So yeah, people are doing their best to stay vigilant, stay focused, and let's get going for this surge.
I do want to come back to the vaccine and your plans for distributing that. When you think about the frontline healthcare workers, as you said, second surge and fear of what lies ahead, it seems like this surge has at least a little bit to do with Thanksgiving. We're 2 weeks past that, and we're 2 weeks away from Christmas, and maybe more people getting together. If you had a message for the public about this pandemic and how to keep it from getting worse, what would that be?
Oh my gosh, you are exactly right. This is a result of Thanksgiving. And without making a political statement, I just have to say, wear your damn mask. That is such a poignant reminder. But the mask, wearing the mask, social distancing, smaller groups of people really does make a huge difference. We've seen that in our own staff. When they sort of violate those rules, if you will, or stretch them a little bit because they're exhausted and they want to see their loved ones, that's where it happens. That's where we get the virus. So anything you can do to just get through. We believe that we're going to settle back down right here before the holidays, and then we're worried to death around the first of the year, another big spike's going to happen. So anything you do to wear your mask, social distance, limit your groups, that would be great. Stay in your pod of people, so.
In contrast to the beginning of the year, I gather most hospitals have enough personal protective equipment for their team members.
Yeah, we do feel much better than that, better now. I remember back in the spring, LifeBridge was literally manufacturing its own PPE. I literally bought 40 sewing machines from Amazon to sew gowns to wear. So yeah, definitely we are in better shape there. We're still having some conservation efforts because we're unsure what the next few months will hold. But yes, we do feel in much better shape with that. Thank you.
In the spring, there was a concern that a lot of people with other health problems, either urgent symptoms that came up or chronic issues, were avoiding getting health care because they didn't want to be anywhere near a doctor's office or a hospital, thereby putting off care that was needed at the time. Do you have that same concern when people are going to hear the message that the hospitals are almost full and they're full of coronavirus patients?
Well, you know what, Jeff? The good news is this time around, we have not suspended elective surgery. One of the things that we saw in the springtime is when we suspended elective surgery, I think it sent a message to the public, don't come. And so people weren't coming for heart attack and stroke symptoms. And, now we are fully open for business, and the hospitals are very capable of caring for you. And we're not just full of COVID patients. Thank God. We are also full of people needing other care. And we've become very skilled at making sure that we're not cross-contaminating and, that we social distance, private rooms, all kinds of measures to take care of our patients and do it very safely. So please don't delay your care because of COVID.
If the COVID cases go up another 10, 20%, does that get to a point where you activate your surge plan, and what would that mean?
Very good question. Jeff, some of our hospitals are already in a phase 2 of their surge plans. That means they've used some capacity that isn't typically open to be able to care for a bit of a bump, that surge that we're having right now. Most of our hospitals have plenty of capacity. Our challenge is making sure we have enough staff. So we're exploring all kinds of different staffing models and extenders to our nurses and our other care partners to really go into a sense of team care instead of team care from the care team, to be able to maximize the number of patients that we can care for. So I'm pretty proud of the team that's really looking innovatively at how we deliver care to a large group of patients that's maybe larger than we're used to.
You're probably not alone in that, in having, it sounds like, a shortage of nurses.
Correct. You know what? It's not just nurses, because of course the virus is affecting everyone, and the spread is not in the hospital, which should give the public some comfort. Because of our protective equipment, we're not transmitting it to one another in the hospital. It's what happens on the outside. And so, that might affect our maintenance workers, our EVS team, environmental service team. It's not just our nursing staff, but that's why we have to get really creative about what roles we're filling. So sometimes we might take somebody from a business office and give them some non-clinical skills to do to help round out the team to deliver the care.
You mentioned the light at the tunnel. We're all hoping it's a short tunnel and a bright light. What will be the hospital's role? And you do more than run hospitals. You have all sorts of healthcare operations. What will be your role in dispensing this vaccine?
So we're very excited and gearing up for the vaccine. That's what's really going to help us be able to manage this and get back to, quote, normal. So we are trying to work backwards. We think we're going to be ready to start vaccinating people by the end of next week. So we're practicing our vaccination clinics, which is pretty familiar to us because we do flu vaccine clinics. And we are prioritizing based on the governor's vaccination plan of our frontline workers, our long-term care facilities, and really wanting to make sure that those caregivers and patients are taken care of first and foremost as the vaccine supply becomes more readily available.
Leslie Simmons, Executive Vice President, LifeBridge Health. We appreciate your time. Thank you.
Oh, thank you so much. Thank you.
The hospitals may be full, but major mass transit systems are quite empty. Major cuts are planned due to the loss of riders on the Washington Metro system. We spoke with General Manager Paul Wiedefeld.
Actually, last year, pre-pandemic, we were just having a better year. We were in high ridership. Our customer service was the highest it's been in years, in terms of them, improving the service we're providing. So that was great. Unfortunately, since then, we've taken a big hit. On the rail side, our ridership is down almost 90%. And it's stayed that way literally almost till today. And our bus ridership has come back a little bit, but it's still down almost 60%. So as you can imagine, that's a huge hit for us financially, as well as clearly what's happening in the community as a whole.
What's your operational status now in terms of service levels, number of trains, number of buses?
Yeah, so basically we're running about 75% of the bus system and about 50% of the rail system, compared to pre-pandemic. The important thing for us to understand, or for Jeff to understand, is our revenues, though, come primarily from the rail side of the house. Almost 80% of our revenues come from the rail. And that's because we charge for distance and we charge for peak periods, where we don't do that for bus. So as rail ridership stays down, financially, it's even a greater hit because that's where most of our money comes from.
And you've announced a new budget proposal that includes drastic cuts, no weekend rail service. What else is potentially on the table?
Unfortunately, we would probably only run from our endpoints 30-minute headways. So trains only every 30 minutes. Obviously, where they share track in downtown core, it'd be 15 minutes. We would have no weekend service. We would shut down at 9 p.m. Relative to 11 or 12 or 1, during what we would do normally. And then also we have to shut down 19 of our 91 stations. So that's on the rail side. What that represents is about 20% of pre-pandemic service. And then on the bus side, we would reduce it to roughly 45% of the pre-pandemic bus service. This is all being driven because we were basically maintaining the system and our employees basically using the CARES Act money. That dries up. It's actually drying up right now. In February, that will dry up. Unfortunately, we are going to have to eliminate roughly 1,400 positions out of a workforce of just over 12,000. And in the budget for the next year, which starts July 1 for our case, what I just walked through those cuts, that's another 2,400 positions we have to eliminate. So that's roughly a third of our workforce that we have to basically eliminate to deal with the financial stress we're under. We have roughly about a $500 million hole next year. We're digging out of one right now of 176 million. That's between now and the end of June.
What's happened to employment to this point?
Basically, what we have been doing is, we've been trying to keep everyone safe, right? So we've been trying to provide the service that does that for both our customers and our employees. But starting in February, basically, we will have to eliminate the 1,400 positions starting in February. That gets us through the budget cycle through to June. And then when July comes, we have a deeper hole, the 500 million I just talked about. And that, again, increases that to another 2,400 positions.
Obviously, you're not the only big city subway system that is dealing with this. Let's talk about the safety side for a second, because that really every town that's got some sort of regional bus system has the same issue, because people are coming together on a train, on a bus, in close quarters. How do you keep your customers and your colleagues as safe as you can?
Yeah, so when this initially occurred, obviously everyone was grappling, how do we do that? One of the first things we did is we only had rear door boardings. We weren't collecting fares, and still aren't, at the front door to protect our operators. We have barriers now to do that, so we will start collecting fares in January on the bus side. On the rail side, we've kept all 8-car trains out there to give people space to stretch out. But so those are the types of things we do. Tremendous cleaning, all the things that you've seen on TV, across the nation. We're doing that. We're learning literally both nationally and internationally. It's things that people are doing to keep, the vehicles safe for people. There's been certain studies that show it's as safe, if not safer, than going to the supermarket. But people are, they're afraid. I get it. It's, when you get in a packed train, you feel that, just like the aviation community dealt with the same issue. So we'll continue to do that. But we've done a lot of focus groups and surveys of our customers. And basically, they're really, their concern is until the vaccine is in place and, people feel very comfortable before they'll come back, particularly on the rail side.
Even with the vaccine, and hopefully society gets back to something like normal middle of next year, later next year, does your ridership get back to its peak anytime soon? I'm just thinking about all of the Zoom calls like this, people working from home, and companies finding out that there are pros and cons, but maybe everybody doesn't rush back to the office at the same time.
I agree. I think in the short term, I think that probably will be the trend. Again, until people feel safe, right? They're not going to come back to the pre-pandemic levels. We're projecting roughly about 34% of our ridership will come back next year. We'll hope that we're wrong, right? That this thing takes off the vaccine and people come back sooner. But we feel that. And then this other issue, which you're raising, is, and then what is the new normal? What's that level of that new normal? No one knows, obviously, right now. But I'm very bullish about the future because, this region, the Washington region, our stations are basically the economy of this region, and it's where all the development occurs. It'd be very hard to find a crane anywhere in the Washington metropolitan area that isn't near a metro station. So the development community is dependent upon this system to work. They're betting on it, right? Now that's where they're putting their investment. And so I know that will come back. And again, we move many more than just work trips. When you think of the nation's capital, with all the tourism, with all the cultural, assets that it has, there's a lot of activity that occurs non-work travel.
How do you decide what metro rail stations to put on a list for closure? And does it really save any money? Because it's not like the you know, the train's going to fly over College Park.
Right.
It's still going to go right through the station.
Yeah. Well, there's in terms of two big things we looked at in terms of which stations are closed. One is if there's stations that are close to each other. So for instance, if you know where Capital One, Center Gallery Place is and Judiciary, they're literally a block away. So it makes sense to shut down Judiciary, for instance, and keep Capital One or keep the Gallery Place open. So that's one. Others, some of our stations serve big malls and stuff that just aren't, you know, they're just not working. They're not, you know, so some of those, so it's based on demand and or proximity to another station. So you have other options. So that's what's driving it. And in terms of why would you do this is because unfortunately, our most of our expense is labor. It's people. So if we don't have to have station managers and, you know, all that brings down the custodians cleaning those stations. Those are basically where we can save some dollars. Unfortunately, it's with people, which is the worst, you know, it's the last thing we want to do, but it's the only place we turn because of the way our budget operates. It's basically people. That's what we do with 12,000 people.
Our thanks to Metro General Manager Paul Wiedefeld. Maryland's longest-serving member of the United States Senate, Paul Sarbanes, passed away on Sunday at the age of 87. Mr. Sarbanes spent 30 years in the Senate, retiring in 2006. He was a staunch supporter of saving the Chesapeake Bay. And as chair of the Banking Committee, he led post-Enron financial reforms and often pressed the Federal Reserve on monetary policy.
The problem with taking up the interest rates, which the Fed has been doing throughout the course of this year, is you dampen down economic activity. Now, you know, you get an impetus to the economy from lower interest rates. Housing, investment costs less. Every time the interest rates go up, the prime rate goes up. All small businesses start paying more money.
Current senior U.S. Senator from Maryland Ben Cardin eulogized Mr. Sarbanes. The two had entered the Maryland General Assembly together in the 1960s.
Paul Sarbanes was known as a senator for his integrity, for his public commitment to public service, his strong commitment to principles. He was a Rhodes Scholar who chose to serve the public rather than using his skills in the private sector for his own personal gain. His entire life was devoted to public service. And what a legacy he has left us by his incredible public service.
Senator Sarbanes' son, current Congressman John Sarbanes, said the family is grateful for the support of Marylanders. Senator Paul Sarbanes was 87. We'll be right back.
As infections spike across Maryland and the nation, how can you reduce the risk of catching COVID-19? MPT gets the facts from health experts. We'll examine the role personal behavior plays, the state of testing in Maryland, and the hope new vaccines may bring. Learn how you can stay safe during COVID-19. Join Jeff Salkin for a special Direct Connection, Monday night at 7 on MPT.
A Montgomery County mom is trying to help students in need one desk at a time. As Nancy Yamada reports, thanks to the power of social media, she has recruited an army of dads to help.
It's good to be involved. I'm very pleased.
The assembly line looks a little bit like the North Pole at Christmas, except these are no elves and they're not making toys. They're dads making desks for kids in need.
There are so many people, parents working from home, children doing schoolwork from home, that there was a need for desks. And then I just happened to see Desks by Dad's Facebook page, and then it all came together.
Neil Gager, the owner of Frederick Lumber Company, answered the call to help make desks for low-income kids in the area by opening a shop, donating wood and supplies, and recruiting his longtime customers to help.
I said, yeah, I'm there, absolutely.
I think the key is having guys who know what they're doing. I mean, these are some of them professional cabinet makers. They do it for a living. Others very serious hobbyist woodworkers.
Gaithersburg resident Mike Mendelow brought his 13-year-old son to work alongside him.
I feel like it's rewarding at the end, but throughout it, it's very hard to do.
It's a sight to behold for the woman who launched Desks by Dads, Jessica Bareilles, a Gaithersburg mom and PTA president of Ridgeview Middle School.
I really started off just trying to find a few desks and collecting them from friends and neighbors, and then I moved to Facebook Marketplace and, very quickly realized that there was more need than available desks.
She soon recruited her husband to make a prototype. Thanks to social media and word of mouth, dads and moms came forward, offering to build desks after work and on weekends. They've built over 200 desks since the pandemic started, and they're hoping to serve beyond Montgomery and Frederick counties.
I think one of the ahas for us has been that, people want to help. I think that more often than not, people want to help. Sometimes you just don't know how to, or you don't know how to get started.
They say many hands make light work, and that certainly is true here, where the dads were able to make 22 desks in less than 3 hours.
I was kind of busy in the corner over there putting the tops together, and then you turn around and see this wall of desks that were completed, so it's quite nice. I mean, it really is.
And there are others donating chairs and lamps. So each child that has been earmarked through the school system will get a desk, a chair, and a lamp, which is really, really cool.
We do most of the deliveries ourselves, and that's really where the magic happens, just to see the look on the kids' faces when they receive a desk. We're sending a message to these kids that they're valued and that their education is important and that they matter.
I'm Nancy Yamada for State Circle.
And that is our program for this week. We're back Monday with a special edition of Direct Connection, expert advice on keeping safe during the pandemic. That's Monday evening at 7. You can find more information on that program and all of our upcoming shows by visiting us on Facebook and Twitter. Look for MPT News. Now, for all of us at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
This program was made by MPT to serve all of our diverse communities.
Programs on MPT are made possible by our members and the following. For over 50 years, UMBC has been preparing students to achieve their goals, from cybersecurity engineers to STEM teachers, data scientists to public policy leaders. UMBC graduates are all around us, excelling in their fields and making an impact in our world. UMBC's flexible, affordable, top-ranked programs prepare you for the career you want. Get going with UMBC. Learn more at